Well, good morning, everyone. My name's Amelia, and today I'm going to be presenting my internship experience over the past couple months for my final capstone project for my Master's of Professional Science in Biomedical and Health Informatics. So my internships over the past couple months, I actually did two different internships in order to get to the 400 hours. So I first worked at a Series A health tech startup called Cured. And then I began working for Kaiser Permanente in their analytical consulting department. So I'll go ahead and get into it. So first, I'll just give you guys a little overview of what I'll be talking about today. And I'll start off talking about my experience at Cured. So I did some data integrity cleanup. I was working mostly in HubSpot and also building some dashboards within a HubSpot as well. And then I started at TPMG in their analytic consulting department. And I'll give you a little overview of TPMG. I was working mostly with SAS and SQL programming and creating Tableau dashboards. And then I'll finish off by talking a little bit about some challenges along the way and some lessons learned. Alrighty. So my first internship or my first sponsoring organization is curedhealth, and they're a Series A health tech startup, and they are a CRM and automated marketing company built specifically for healthcare. So what they do is they create curated kind of messaging and automated marketing directly to patients. So they're HIPAA certified. And so essentially they're working to increase access of care and just increase the way that health systems can reach out to patients directly. So I was working with the business development team, and my manager was Josh, and he's the VP of business development there. And some of my project goals throughout my internship there was to improve the data integrity of their HubSpot sales management platform. And then, so what I did was I created workflows and dashboards to ensure consistent record upkeep, and then also dashboards to track team members' outreach, deal progression, and market segment activity. All right. So during my time at Cured, I updated over 4,000 records within the sales tracking platform HubSpot. So HubSpot is a software that companies can buy, and it is essentially a CRM for sales. So it tracks all of your different companies that you're reaching out to, all of your outreach and your deal progression. So it's just a way for a sales team to kind of track their activity and to keep on top of how deals are being made and how different BD representatives are reaching out to clients. But within HubSpot, there's just a ton of data, but it's kind of hard to keep on top of. And especially at a small company, the team members are already so busy kind of doing outreach to customers that they don't have time to really work and look into the data. So that's kind of where I came on to help them. And so one of my main tasks was that I would research and build out prospective customers within HubSpot. So anytime a team member kind of wanted to look into a certain company or find contacts from a certain company, they would reach out to me, tell me the company. I would research the company and find contacts through Zoom Info, which is another software that just kind of gives contacts through. They kind of pull data from online and get people's like emails and LinkedIn and stuff like that. So I would build out companies for them in that way. But then my main job was to go into all of the company records within HubSpot. So they had about 50,000 company records and make sure that certain fields were populated. And this was super important for them because in order to create dashboards that allows them to kind of track their activity, all of these fields need to be updated within each of the records. So by doing this, it was a huge help to the BD team who is struggling to keep on top of updating all their records just because there's so many and there's only so much time in the day. So what I did to kind of make it easier for myself was I created multiple automated workflows within HubSpot. And so these allowed the system to automatically update certain company records. So it took a lot of the workload off for me just because there was so much in there to fix. And then obviously not all of them could be fixed automated. So I would have to go in by hand to fix those. But this photo here is an example of a workflow I created. So it's kind of an if then logic. So you just put in if the market segment is marked as healthcare, then in all of these different things, and it's not a partner or a customer, it would automatically update it to a prospect. Since all health systems and healthcare services companies are considered prospects to Cured, this was an easy automation that I could do. And this automation will update future records. So if anyone in the future puts in a health system or a healthcare services company and they didn't mark it as a prospect, it will automatically update that. And this is super important because all the dashboards that I then created after I cleaned up all the data within HubSpot are based on these type of fields. So it then allows them to track all their prospect companies, which was super helpful to them. And so then after I did that, all that data cleanup and everything, I started building dashboards. So this allowed the team to kind of track their outreach, deal progression, and market segment activity. So this was a huge help to them because before these dashboards, they kind of were unsure who exactly they were reaching out to. So these dashboards kind of at one quick glance allow you to just really see the different market segments and what you're really doing, just because at Cured, all their outreach was email based. So they were sending each rep was sending about 700 emails every week. So these dashboards really allow them to easily see who exactly they're emailing based on specific categories. So yeah, and here's some of the dashboards with a larger view. So you can see the first one, it's on a weekly basis. So it shows each business development representative and then what market segment each of them are reaching out to. So there's digital health, health systems, healthcare services, partner, payer. So you can see they're mostly reaching out to health systems. So that's kind of some significant knowledge. Maybe if they want to start reaching out more to digital health companies, they could easily see that here, that they need to kind of ramp that up. And then the next one is just calls and emails in the last 7 days. So what they're kind of up to on a weekly basis. And then this one is super interesting. It's companies that haven't been contacted in the last 90 days. So this one was super important for them because you could just go to your name, click on your bar graph and easily see companies that you kind of forgot about and maybe want to start reaching out to again. And then the last one is deals with price quotes in the last 10 days. So this easily allows you to see which companies are kind of further along in deal progression. So you can make sure to stay on track of those. And then my final project at Cured was working with the CEO of the company. And through my dashboards, we identified a need to increase outreach to healthcare services companies. So me and him worked together to research subtypes. And then also I added a bunch of new companies for outreach in HubSpot and assigned them an owner. So I was working directly with the CEO on this project, which was really cool. I felt like being so new and just an intern working with the CEO was a super valuable experience. And so I got to meet with him a couple of times, which was really cool. And I kind of created this list and we made sure to mark within HubSpot which type of healthcare services company it was. And he was also super interested in private equity backed healthcare services companies, just because he used to work in private equity. So he had a lot of connections at those type of companies. So he wanted me to make sure that if it was a private equity owned healthcare services company, I was marking that off on HubSpot. And then he could go into his network and see if we could kind of have an easier in with those companies that way. So I spent a lot of time looking at private equity firm portfolios and seeing what type of healthcare services companies they were invested in. And then I created a healthcare services tracking dashboard within HubSpot so the team could easily see how they were performing and specifically outreaching to healthcare services companies. So those were my main projects within Cured. And prior to working at Cured, I had never worked in sales or business development. So it was really cool experience to be a part of that team and kind of bringing data and analytics to them and kind of showing them the power of data and how you can use it to kind of improve your performance as a team. And then my second sponsoring organization is Kaiser Permanente. And I was working within the Permanente Medical Group, which is Northern California's provider organization. So the Permanente Medical Group is actually the largest medical group in the United States. And I was working within TPMG Consulting Services in the Analytic Consulting Department. And my manager was named Paul, and he's a data and analytics and reporting consultant, level 4. And I was within the primary care homeroom. And my project goals throughout the summer were to create a new prenatal screening performance metric and dashboard that would be used to visualize this data. And then I also was working on transferring an existing procedure dashboard from Excel to Tableau, and then also adding some demographic information to that. Righty. So I do have a disclaimer. I am not really allowed to provide specific details about my projects, including pictures of dashboards and code, because both my projects included analyzing and querying highly classified patient health information directly from the Clarity database, which holds all the records from Epic. So because of this, our department has a very specific and strict sharing policy, and we are told to treat all of our project information and details and stuff like that as proprietary information. And I actually wouldn't even be able to get any of that, like any of my work off of that computer that I was using for Kaiser. So yeah. If you think I'm being kind of vague, or if you have more specific questions, I might not be able to answer them, but I'll try to be as specific as I can. So my first project with TPMG was I was working with the chair of chiefs of the OBGYN department. So she was considered my client or my sponsor for my project. And I was creating a new prenatal screening metric. And so this metric was to be modeled after existing HEDIS measure specifications. So HEDIS are kind of performance metrics for primary care providers. So there's a ton of them and they're all highly regulated, and you have to provide where each of your providers stand on each of these HEDIS measures. So the new screening metric I was creating isn't a HEDIS measure, but they wanted me to model it after existing HEDIS measures. So my initial research was I was researching existing HEDIS measures and specs, and then also California recommendations on this certain screening protocol to create all the specifications for my new metric. So that included defining the measurement period, the initial population, and then the numerator and the denominator. So after you specify all of that, you then have to go into the data. So then I started using SAS and SQL code, and I directly was using that to query the Clarity database. So I had to as part of this internship, I also got trained in Clarity, which is Epic's data model. And so essentially Kaiser uses their EHR is called Health Connect. And Health Connect is where all the providers and all the patient information goes into. And then every day at midnight, all of that data is ETL is performed and it's put into Clarity. And so then Clarity is what all the analysts can query off of. So I was working directly with that, which was really cool. And so that's how I then got all the data that I needed to create my metric. So getting the numerator and the denominator, and then I exported all that data to Tableau and created a dashboard to visualize the performance by service area and medical center. So we're TPMG is working regionally for Northern California. So they break up Northern California into 13 service areas, and there's about 50 medical centers. So my provider was really interested in seeing the performance by service area and also by medical center. So I had to segment the data that way and then visualize it that way in Tableau. And then my next project was also in the OBGYN department, working for one of the chiefs of OBGYN. And I was working to update an existing dashboard that was an Excel dashboard and transferring it over, putting it into Tableau, and then also adding race and ethnicity information. So this initial dashboard was in Excel, so it wasn't very user friendly, and there wasn't a lot you could do with it. It was kind of just a standing plain dashboard with different tabs. And so I went into the database and used SAS and SQL again to add race and ethnicity to the existing data table that was being used to visualize the existing dashboard. And then I transported that table to Tableau and created a brand new dashboard. So this dashboard was showing this certain procedure based on service area and facility. And then I had to go in and add it based on race and ethnicity. So that was very interesting. And the goal of the new dashboard was to make it more user-friendly and interactive by moving it from Excel to Tableau. So something that was super cool about both projects is that my clients for both of the projects were physicians. So I got to work directly with them. And TPMG, their mission and their goal is to always use design thinking. So the end user is a huge important part of every project. So I would meet with the physicians every other week and kind of tell them about my progress. And as I was building my dashboard, especially, I was always keeping them in mind. And it was really interesting. And I felt like a really good experience for me, because normally when I was working with Tableau in my grad school classes, I was kind of the end user. I was designing it based on things that I liked. And so it was interesting just to see how different people like to visualize things in different ways. So that was definitely a very cool experience to have. So now I will talk about some challenges and lessons learned along the way. So my first one is that I was kind of thrown into the hectic world of business development for a small Series A health tech startup. So as I said, I had no prior sales or business development experience, and I truly realized how integral business development is, especially for a new company. So Cured, especially, after they're done with all their funding, all of their revenue is going to be based on how many clients they have and who they have to buy their product. So business development was super important for the company. And just because they were trying to grow, and especially after their Series A, it was a huge time of growth for them. So kind of being right in the center of a super important segment of the company was just super cool. It was kind of overwhelming at first, just because I had no experience in sales or business development. So just kind of learning all of the language and things like that they used was definitely a learning curve. But yeah, it was a cool experience. And going to number 2 as well, I also learned some new software and programming language. But I'd say the one thing I learned through all of that was that you kind of have to stay patient and realize that you're not going to learn it all at once. And each day you're going to learn kind of a new thing. And then by the end, as you can see in HubSpot, I learned how to create workflows and all these dashboards. And that was after I had never even heard of HubSpot before starting the internship. And then also with Kaiser, they all of their servers and most of their like all their programming stuff was based on SAS programming. And I had never learned SAS, but it wasn't a requirement for the internship to know SAS, because they kind of realized that it's not the most up-to-date way that people are learning nowadays. So that was also a learning curve and kind of a challenge at first. But something I realized at both companies, at both Cured and TPMG, was that everyone is super receptive to new people. And whenever you have a question, everyone was always willing to help, which was really nice. So yeah, that was something I learned that was interesting. And then number 3 is while I was at TPMG, I was juggling the 2 different projects and deliverables and those 2 different clients at once. So this was something that was kind of overwhelming at first, just because I knew that I had to do these 2 things within a certain time period. And so that was kind of just kind of hard to wrap your head around at first. But I realized that with organization and sticking to a schedule, you can definitely conquer both successfully. So something that I really liked was my first day at TPMG, I met with my manager and we created a schedule for me. And it was on a weekly basis. So I knew each week what I had to complete for each project. So that really helped me kind of conceptualize what I was going to be doing for each project each week. And so that's something I'll definitely take with me for future projects. And then number 4 is something that I think is really interesting about my internship experience, is that I worked with both a small startup and a very large regional health system. So Cured was about 50 employees and TPMG is over 20,000 employees. So definitely a dichotomy and something that was super cool to experience, especially working for each of them back to back. So I felt like I really got to experience the pros and cons of working for a small versus a large company. And then this really allowed me to reflect and decide how I want to start my career in the future. So yeah. Thank you so much. And I hope you enjoyed learning about my internship experiences. And if anyone has any questions, I would love to answer.